Hi, this is Catherine Beeler. I'm doing my medical assessment. I have a blank piece of paper here just for notes for my report.
You are called to the residence for a 65-year-old male with chest pain.
All right. I arrive on scene and I'm putting my gloves on before I get out of the ambulance. So that's my PPE. Assess for scene safety. Is my scene safe?
It is.
Okay. My nature of illness is chest pain. Number of patients, I appear to just have one patient. Is that correct?
Correct.
I'm going to consider additional resources. I am going to go ahead and call for ALS backup, and then consider C-spine immobilization, which I don't think I need at this point. All right, then my general impression of the patient is poor. And hi, sir. My name's Catherine. I'm from the Florence Fire Department. What is going on today to have you call us?
My chest and my stomach are really upsetting me.
All right. And so my level of consciousness, he's talking to me. So on the APU, he is alert. And my level, the chief complaint is chest pain, as he just told me. I'm going to assess for any life threats. Are there any immediate life threats?
You do not see me.
All right. Now I'm going to assess airway. So I am going to check his respiratory rate and rhythm and quality of respiration. And what is his respiratory rate?
He's breathing at 22 times a minute.
All right. And I'm going to put an O2 sat on him. And what is that?
Satting at 93%.
All right. So I am going to...
90%.
90%, okay. So I am going to put a non-rebreather mask on at this point, just at 10 liters a minute. And I'm going to move on to my circulation. I'm going to check his heart rate, check his pulse and the rate, rhythm, and quality. What is his pulse rate?
Pulse is 120, strong and regular.
All right. And I'm going to look for any bleeding. There's no bleeding.
You do not see any bleeding.
I'm going to assess his skin temperature, color, wet, dry.
Pale, cool, and diaphoretic.
Okay. All right, so I believe that he is in the early stages of shock. I would call him a high priority transport, and we're going to get moving to the hospital.
Okay.
I'm going to continue my assessment in the ambulance. So now we're in the ambulance, and I'm going to start getting some history. And so, sir, when did all this start?
Pain started about an hour ago with a sudden onset of weakness, nausea, and sweating.
All right. And does anything seem to change the pain? Does anything make it worse or better?
No, it started when I was resting, and it has not stopped or improved with rest.
Okay. And can you describe the pain to me?
It started out as indigestion, but now it feels like my chest is being squeezed.
Okay. Does it move anywhere? The pain move or radiate anywhere?
Radiates to my left arm and jaw.
Okay. And on a scale of 1 to 10, 1 being the minimal and 10 being the worst pain ever, what number would you give this right now?
Oh, it's an 8 out of a 10 scale.
Okay. Has the pain changed? During this last hour? Has it always been an 8 or has it?
Yeah, it's been the same.
Okay. And if you take a deep breath in, does that change it?
No.
Have you taken any medications to improve or change the pain?
No.
No. Okay. All right. Do you have any allergies to medicines?
Sulfa and antibiotics and penicillin.
Okay. And do you take any medicines?
Oh, I take metoprolol and lisinopril.
All right. And do you have any medical history?
I just have high blood pressure.
Okay. And last time that you ate or drank anything?
I haven't eaten anything all day, just been too nauseous.
Okay. And what were you doing prior to this pain starting?
Nothing. Just sitting there watching Wheel of Fortune, just resting. And then my stomach problems started, and then wasn't until my chest hurt that I started to call you guys.
All right. So now I'm going to move on to my secondary assessment, and I'm going to check listen to heart and lung sounds, expose, look, listen, feel. I don't see any obvious deformity or something sticking out of his chest. And how do my heart and lung sounds?
Oh, lungs. Lungs are clear bilaterally.
Okay.
And heart, you hear the love dub, it's normal.
Okay. Now I'm going to get a full set of vital signs. I'm going to check a blood pressure. I'm going to feel his pulse for 30 seconds, then multiply by 2. Check respiratory rate for 30 seconds, multiply that by 2. I'm going to again check oxygen saturation, and I'm going to put him on a 12 lead since he's having chest pain. What is my blood pressure?
Call you back. We're doing a test. Call you back in 5. Blood pressure is 160 over 90.
And heart rate?
Justin. Heart rate is 120.
Respiratory rate?
22.
And current oxygen sat?
Back up to 97 with oxygen.
Okay. All right. So my field impression of this patient is that he's having a cardiac event and potentially a heart attack. I'm going to continue my plan of high priority transport, so we're continuing on to the hospital. I'm going to call medical control, and because I believe that I could give him 324 of aspirin would be a good intervention. So called medical control. What do they advise?
Yeah, go ahead with the aspirin and attach to a 12 lead. Your paramedics have arrived on scene. Go ahead and give report.
All right. So I did give my aspirin. And okay, hi. So this is Bob. He's a 65-year-old male that has chest pain that started about an hour ago while he was at rest. He currently, his blood pressure is 160 over 90, heart rate 120, respiratory rate 22, 97%. He is on 10 liters on a non-rebreather mask right now. Lungs are clear. His pain is an 8 out of 10. It does radiate, it's squeeze in his chest and radiate to his left arm and jaw. No previous history of heart attack. He takes metoprolol, lisinopril. He's allergic to sulfa and penicillin. I gave him aspirin, 324 milligrams, and that's all I got.
Excellent. Good job not getting distracted with the phone call. That's real life EMS, and so good job.